Welcome to Unit 4, Part 1 of Molecular Pharmaceutics, focusing on nanotechnology and targeted DDS. This video will cover key aspects of pulmonary and intranasal drug delivery. This is presented by Dr. Krishna Yadav. The pulmonary and intranasal routes are two important gateways for drug delivery, offering advantages like bypassing first-pass hepatic metabolism and providing a rapid onset of action. The pulmonary route has a large surface area for systemic delivery, while the intranasal route utilizes nose-to-brain pathways. Pulmonary drug delivery administers therapeutic agents directly to the lungs. It has a long history, with modern development starting in 1956 with the pressurized metered dose inhaler. Today, delivery platforms include DPIs, nebulizers, and soft mist inhalers. The lungs offer a unique pathway for both local and systemic drug delivery due to anatomical advantages. These include a large surface area of 70 to 140 square meters, thin alveolar epithelium, a rich blood supply, and no first-pass metabolism. Additionally, it is a non-invasive route with a rapid onset of action. Key advantages of pulmonary drug delivery include local targeting, reduced systemic side effects, and rapid absorption. It offers high bioavailability and is non-invasive, improving patient compliance. It's also suitable for macromolecules and provides rapid onset for emergency situations. Limitations include technique variability, mucociliary clearance, and a limited dose volume. Local side effects like cough and oral candidiasis are concerns. Formulation complexity and potential lung toxicity with chronic use also present challenges. Pulmonary drug delivery is applied for local therapy in conditions like asthma, COPD, and lung cancer. Systemic applications include inhaled insulin for diabetes mellitus, pain management with inhaled opioids, and vaccinations. The respiratory tract is organized into three major regions. The nasopharyngeal region filters large particles, the tracheobronchial region is lined with ciliated epithelium for clearance, and the alveolar region contains millions of alveoli for gas exchange and drug absorption. Aerosol deposition is region-specific. Inertial impaction traps particles greater than 10 micrometers in the nasopharyngeal region. Gravitational sedimentation deposits 2 to 5 micrometer particles in the tracheobronchial region. Brownian diffusion captures very small particles in the alveolar region. The pulmonary target landscape includes conducting airways and the alveolar region. The alveolar region, with its thin barrier and alveolar macrophages, is key for systemic absorption. The cellular defense barrier phagocytizes small particles. The lung has several defense mechanisms. These include filtration in the upper airways, mucociliary clearance in conducting airways, and the cough reflex. Alveolar macrophages provide phagocytosis, and enzymatic degradation and surfactant also play important roles. Drug deposition is governed by three primary mechanisms. Inertial impaction is predominant for particles greater than 5 micrometers. Gravitational sedimentation is important for 1 to 5 micrometer particles. Brownian diffusion affects particles less than 0.5 micrometers. Inertial impaction affects high-mass particles greater than 5 micrometers in the upper airways. Gravitational sedimentation is optimal for 1 to 5 micrometers, settling in small airways with breath holding. Brownian diffusion affects particles less than 0.5 micrometers, which are primarily exhaled. The optimal therapeutic range for pulmonary delivery is 1 to 5 micrometers, reaching small airways and alveoli. The aerodynamic diameter is the key parameter, depending on geometric diameter, particle density, and dynamic shape factor. Aerodynamic diameter is determined by geometric diameter, the physical size of the particle. Particle density, which is how tightly the mass is packed, affects momentum. The dynamic shape factor accounts for non-spherical particles. The aerodynamic diameter also involves the standard density of water and the dynamic shape factor. The standard density of water is a fixed reference value used by scientists to compare inhaled particles of different shapes and densities. Aerodynamic diameter is the effective size of the particle based on its flight and settling, not its actual physical size. It is the single most important number for inhalation therapy. Particles between 1 and 5 micrometers reach the deep lung generations. These are the references used for the content presented in this video. Thanks for watching.